Okay, we are filming now.
Okay, so the first thing is benzoin. That's tincture of benzoin. And I place this around the. This is the Oasis matrix. That you do not take off. Okay, so you're putting more of these stereo strips on. You want to put them away from the stereo strips that have the Oasis on.
And should we put stereo strips on if?
Yeah, well, we're gonna get to that in 1 second. So this helps everything to stick so that it doesn't fall off. Get the fan for me. Okay. Zoom in even more. Yeah. Because I just want, exactly, just the one. I don't want any other stuff in here. Okay. The next thing that we're going to be putting on is this, which is the Adaptic, or they come in different brands, Curad, but the whole point is that it's non-stick. It's got oil emulsion, so it'll keep the wound moist, but not too moist. Okay.
And those are available where?
They should be available at CVS, at Walgreens. You can cut them into pieces, basically like arts and crafts, you know. So the whole point is just to cover the matrix, the Oasis, just like that. You put a little piece here. It's okay to overlap it. Okay, now then the next thing is stereo strips. These are stereo strips. You have 2 new gloves for me. This stuff is sticky. So I would get some gloves so that when you're using this and you're cleaning it, that it's your hands should be clean. You don't want to get the burn wound infected. You don't have to be sterile, but you should be, clean. Okay, now these are the stereo strips. Okay, and then these are used to attach the adapter and keep it down. So just like this. Just like that. Okay, then the next thing is the wound vac. Okay, this is what it looks like. Right. They'll have a bunch of these that they'll deliver to your house or wherever they decide to deliver here. You'll take a bunch of these with you. So there's different parts to it. First part is this, which is the black sponge. The second part of these, which are the stickers. Okay. Now the stickers have 2 parts to them. They're numbered, so you can easily. Now, you can cut this. Zoom out a little. So I prefer to cut it in half this way first. Okay. Now I have 2 pieces, and then I can cut it the other direction. Like this. Okay. So usually I cut a couple of these like this. Alright. And then usually you want one of these, you're going to probably want to cut into narrower strips because getting the seal is the important. You want to make sure everything is sealed. You can cut them any size you want. You just have to remember that there's a 1 and a 2, right? So this 1 and 2 you have to have and this is the little piece right here that's going to pull. So you don't want to cut it like this way, you're not going to be able to pull it off.
Okay.
Okay, so you can cut them to different sizes. Now then, the sponge is like this, but obviously this is too big. So we have to cut the sponge into a size that is more similar to the size of the actual matrix or the burn obviously, whatever scissors you use, just I would clean them, you know, with like isopropyl alcohol or something. So there it is. I've made my sponge about the same size as the burn wound. Okay, and then now I take these stickers, I put the stickers over the sponge. Okay, so now you want to make sure that you are keeping the sponge centered over where the matrix is as you're doing this. Now this is what it says number 1, right? So this one comes off as number 1, and then make sure it's all stuck down, right? And that's why this benzoin helps. Then there's a number 2, and all you do is you hold the blue, you peel it back. While you're holding the blue down, give it a little counter tension, then it doesn't come off. Now, the third part is to just peel the blue off, and you just hold counter tension on the plastic like that, and then it peels off. It has little perforations. And you take another one, and you overlap them a little bit. You want to give, you know, a couple inches so you get good seal. Same thing. That's number 1, right? Then number 2, coming like this. The third stage is holding it here, and then tearing the perforations. Okay. I got one more. I'll come down here distally. This one. Number 2. It's important to hold the pressure. If you don't, you pull, you can rip off what you did, and then it's sometimes a mess. Okay. Now, then the final stage for the wound vac is this thing here. I call it a lily pad. I'm not really sure what it's supposed to be called, but it's the suction cup part of it. So how this works is this is going to be attached to the actual wound vac. This is the part right here that then gets plugged in. So when the battery powered device comes in, zoom in more. Oh, bless. And you're going to turn, see how there's little notches? It'll fit into so this is the male end of it. There's the female receptacle, and you turn it, and it'll click. And you want to make sure that seal is correct. Now, this is similar to the other thing. Now, the only tricky thing here, which is not really tricky, but just to remember, is try to center it. So you put all the plastic down first. Okay, now then you need to make a hole that's at least as big as this, you see? Okay, you can make it about, you can take the scissors and cut right into the plastic. Sometimes it's a little tricky, but you can do it. You just take the plastic off, at least a dime to a quarter size off, like that. Just remember, it's got to be at least as big as that hole. And then you want to position it coming off in a comfortable fashion. Like, you don't want to put it this way, because then it's going to be running down the leg. You don't want to put it in this way. So the most comfortable it's probably going to be, so the cord comes up here towards the hip. So position, you peel off. Again, this says number 1. So you take the number 1 off. You center this hole right over that, okay? And you put this down. Same thing here. You want to hold counter tension, and you see this little paper says number 2. Okay, so you take number 2 off. Make sure it all sits down. And similar, the third one is the blue one. Blue one can be a little tricky, but if you nails, you should be able to get it. See how it's peeling off? Okay, and that just comes off. Now, then the only other thing is, and what I like to do is, we had some of these little ones we had left over. I like to reinforce it. Sometimes it'll leak, and usually if it leaks, it's leaking around what we just put on. So,
and then it makes a horrible beep.
And then it makes an alarm, and then it beeps, and then you can't go to sleep or anything.
1,
horrible.
2, blue.
1, 2, and blue. Okay, and then this one is just something that, I don't know, I kind of created this little idea, but you know, I put this one here, I hold it up, create like a little mesentery and stick it to itself. All right, and the reason I do that is because if you pull on this, it pulls onto this mesentery and it doesn't pull onto here. So if you accidentally pull this, you're not going to rip the wound vac off. Okay? And that's it. It's done. This comes with a clamp. There's a clamp thing here. So you can temporarily clamp it. So you can put the suction on, and clamp it. You know, if you got to like take a shower or go to the bathroom or whatever, you got to disconnect it. You don't want to use the wound vac in the shower. I've had patients do that before. You can short circuit the machine and it'll blow up. So don't bring it in the shower with you.
And then you still have to do like the whole plastic bag thing if you're going to.
So you still want to put the plastic bag, up to here. Put a garter belt on or whatever you need to tape it. Duct tape is really the best. But that's it. That's the one.
So this, I would disconnect the vacuum if I shower.
Yep.
When I shower.
And then you plug it into what? 120 millimeters of mercury?
125.
125.
Yep.
So that's the suction pressure that you would make sure it goes back to.
Yep. And you can just take isopropyl alcohol to clean this, just to make sure that it's still clean before you put it into the receptacle.
And then when would she ever change the steri strips? If she needed
So this sponge is designed to last for 1 week at the most in something that doesn't really have a lot of exudate, something that there's not a lot of fluid. If there's a lot of fluid, then it has to be changed within usually 3 days. So I would bring enough that if you had to change it every 3 days, then you bring enough of these supplies and canisters. But it should last 7 days.
How would I know if there's extra liquid?
So the canister, if it fills up, then you have to. Or if it's alarming, because there's a leak, then you have to. Or if you notice like liquid, leaking down here or here, then you have to.
So then when you change the dressing, you have to redo the not Curlex, the this thing, the white thing?
No, so when you take off the wound vac, you'll see the adaptic with the steri strips that we put down. If that's intact and it's okay, then you can leave it. But if it's falling off or if it looks like there's a lot of liquid, then you want to take that one off and then put another adaptic on. You can change the adaptic as many times as you want, but you don't want to take off the actual matrix. So that's why I put them on in 2 separate ways. One with the window painting in one direction, and then these are very clearly different, so they're distinct, so that you can know that those are different. Okay. And then now we'll wrap it.
I have one more question on the clamp. The clamp works. So you're saying if I am going to shower, I clamp it? Is that?
Yeah. So it'll be suctioned, all right, and it'll be on suction, and then this will be. You'll see this will go down flat. Okay, and it'll be like a little hard and go down. Now at that point, then you can clamp it. Like if you need to go to the shower, then put the plastic bag up, wrap it with duct tape, take a shower. Then when you come back, unclamp it, connect it back to the suction. Okay.
You're saying I should wait till it's down? I'm sorry, I missed it.
Yeah. So when you plug this into the device, then it'll start sucking, and then the sponge will get hard.
Okay.
Once the sponge is hard, then it's fine. You leave it, and it should run continuously for the most part. If you do need to, for instance, take a shower, then you would clamp it. That would be when you would clamp it. Then afterwards, then you would unclamp it and reconnect it.
Okay.
And then this is the Curlex, which is gauze. You can actually use any type of gauze. And for this, we're going to wrap Bethany's Ranger knee up for me. Like that.
Do I need to film this right?
Well, yeah, probably, so that she knows how to do it. An important thing here that I like to do is to wrap the Curlex under this so that it doesn't bother you. Okay, so you get a layer of gauze first. Okay, then you can wrap over it. If you wrap straight over it, this can dig into you and it can bother you. Okay, and then the Coban, we don't have the packaging for the Coban, but this is what it looks like. We don't have any other packaging, do we?
It's the same stuff they wrap over cast. It's just not wet or plastered.
It's not, yeah. And the only, oh, you do have, yeah, you just show the packaging. So here's an example of what it is. Pro Flex.
Okay.
Pro Flex. cohesive, flexible bandage.
Got it.
They have it at CVS.
So yeah, all this stuff should be, you know, you should be able to get it at CVS. And this is really just to kind of like a reinforcement, just to hold everything into place. You don't have to wrap this tight. It's not, as you can see, I'm not wrapping it tight. You don't have to cut off your circulation here. It's just, and then once you put it on, then you just kind of form fit it, and it should kind of stick to itself, just like that. Okay, that's it. We're done.